Hi, this is Dr. Justin Anderson with Optimal Spine and Posture. Now today we're going to be going over the 8 common causes of low back pain. Now starting with the first is a loss of lumbar lordosis, or normal curvature in our low back. Now from the side we're supposed to have 3 curvatures: our neck, upper back, and low back curves. Now we lose our lumbar curve here, we get abnormal stresses and loads in the wrong areas of the spine, and this can generate pain. Now, the second most common cause of low back pain would be too much curvature in the lumbar spine, known as hyperlordosis. So from the side, if we have too much curvature here, often coupled with pelvic flexion, what this does is it abnormally loads the facet joints, and this can be a huge pain generator as well. So how we figure out what a normal low back curve is for you, based on x-rays, we look at what's called your pelvic morphology. So based on your pelvic morphology, this tells us how much curvature is normal for you. Now the third most common cause for low back pain would be an anatomical short leg. So from the front, the top of our femur heads go into our pelvis. So if we do have one leg that is shorter than the other, this will tilt the pelvis and commonly cause low back pain and asymmetrical loading. So this is a common x-ray that we look at. If you have a short leg, we can't make your legs grow any longer. Things like heel lifts can help out with this. Now the fourth most common cause of low back pain would be lateral translations of the rib cage. So from the front, when we look at posture, we look at x-rays, we see the rib cage shift left or right like this. This can cause asymmetrical loading in the low lumbar spine. 2/3 of our body weight is up here. Anytime we shift left or right like this, we're gonna get a lot more compression on one side of the body compared to the other. Now the fifth most common cause of low back pain would be a scoliotic curve, or scoliosis. Now, most commonly, we hear of adolescent idiopathic scoliosis, but scoliosis does get more prevalent over time as we age. We see a lateral curvature in the spine, but we have a rotational component that we see, so it's truly a 3D deformity. As we age, common with bad low backs is they'll start to degenerate, they'll start compressing down and buckling into a scoliosis known as a de novo scoliosis. Now, the sixth most common cause of low back pain would be degeneration. Now with degeneration, we commonly see on x-rays are bone spurs, we see spinal stenosis, we see the openings that our nerves exit in the spine start closing, and this can impinge nerves that can cause pain. Now the seventh most common cause of low back pain would be disc bulges or herniations. This can come from an acute injury like a lifting injury or a fall. Most commonly what we see is this can happen slowly over time. Asymmetrical loading or loads, stresses and loads in the wrong areas of the spine can degenerate this over time and start herniating the backwards to impinge nerves. Now the eighth most common cause of low back pain is what's called spondylolisthesis. This is most commonly at L4 and L5, and this is a form of instability. It also can happen from a fracture. So when we start getting these instabilities or shifting forward of L4, L5, that can close down the spinal canal and also cause pain. Now all of these causes, as you can see, are diagnosed on x-rays. We need x-rays to diagnose these. Now all of these common causes here come from a different source. Now every source needs a different treatment. That's why everyone that comes in gets individualized care to figure out what is happening with their low back and how to fix it. Now, if you or a loved one are suffering from low back pain, or a friend suffering from low back pain, please call our office at 208-748-5909, or find us on the web at optimalchiropracticboise.com and ask for a free consultation. This is Dr. Justin with Optimal Spine and Posture. Have a wonderful day.